Changes are coming to the Interim Federal Health Program as of May 1st. The program offers health care for refugees, and the changes were introduced in the 2025 federal budget. Currently, the program offers full coverage for eligible prescription medications, dental and vision care, as well as mental health support and assistive devices like wheelchairs. Come May 1st, refugees will have to pay $4 for those prescriptions, in addition to 30% co-payments for everything else that was previously covered. Nadine Louis, the Executive Director at Action Réfugiés Montréal, says the changes will have an impact on refugees beyond healthcare.
Refugees depend on this program for basic healthcare. Many already struggle to afford food and housing, so this co-payment will prevent them from getting the care they need. This will make people sicker and put more pressure on already, strained hospitals, while healthcare costs rise. And also, this co-payment plan will cost Canada more, not less.
Immigration, Refugee and Citizenship Canada said in a press release, basic health care benefits, including doctor visits and hospital care, will remain fully covered under the IFHP, with no co-payments required. Migrant rights groups like ARM want the changes to be reversed. A social media campaign titled No Cuts to Care was launched by healthcare workers with support from migrant rights groups. The Phones app saw participants gather on Zoom to make calls to Prime Minister Carney, MPs, and other ministers to voice their grievances. After 15 minutes on Zoom, participants had made 60 phone calls and sent 63 emails. Further in the IRCC's press release, it states, "This change supports the long-term sustainability of the IFHP so it can continue providing essential support to current and future beneficiaries." Louise believes these cuts are just the beginning.
These cuts are part of Carney's austerity agenda and signal that more cuts are coming. And I think definitely we must oppose all cuts. Our communities healthier when everyone has access to care.
The IRCC responded to Local 514 in an email statement, and they said, "The Government of Canada has taken concrete steps to strengthen the immigration and asylum systems and reduce pressures." They say the program will continue supporting eligible beneficiaries while keeping the program fair and consistent with other publicly funded health insurance programs that provide supplemental benefits, including those available to many social assistance recipients. The IRCC's preliminary estimates indicate these changes could result in approximately $126 million in savings in 2026-2027 and $231 million onwards. They also say it should be noted that the cost of the program is largely determined by the volume of eligible beneficiaries and the length of time beneficiaries remain eligible for coverage. In 2025, they say the number of new asylum claims made in Canada decreased by 1/3 compared to 2024. And finally, they add, the Government of Canada remains committed to protecting vulnerable individuals. Essential care will continue to be fully covered, and the impact of these changes will be closely monitored to safeguard public health and ensure Canada continues to meet its domestic and international legal obligations.